Certainly, 2020 was an incredibly difficult year, a myriad of tragedies. All of these things reverberate in vulnerable populations and has definitely reverberated in the community that I serve. I've also actually been surprised sometimes by the way that life does not change for my patients, even in the setting of what is a national tragedy. And for me, that has brought the idea that this has historically been a community that is so far gone, a person that is so far gone, that the world doesn't change for them. It's still the same level of depression or anxiety. My life has been a series of pointed arrows to bring me to this population. I was born in the Philippines and I was raised by a Japanese American adoptive grandmother. I always spoke English, and at the same time there was this real fluidity with Tagalog, which is the main language of the Philippines. I came to the US when I was 10. I began to see the dearth of Tagalog in my life, the dearth of that kind of identity through language, and it was actually pretty depressing. I realized that there were this whole other world of valid human connections that I could make through Spanish. And once I realized that and the power of communication, it unlocked something in me. So 4 out of 5 days I work in the hospital, working in the emergency room or working on the hospital floor. I work in a community hospital. There are patients with a long history of marginalization, often poverty, patients who are so disconnected from their own sense of self and what it takes to live a rewarding and connected life. People come in crisis because of chronic underinvestment in this community. In a way, there is so little access to treatment, to diagnosis, to being understood, and also fear. There's so much misunderstanding, not only in the medical world and what the medical world can provide, that fear of what it means to see a psychiatrist, to see a mental health professional, that fear is real also. And when people are left alone, for decades to fend for that on their own, it makes sense that people do come in crisis, and so often. And at the same time, when we sit down and are with patients, we can begin to grow and instill that hope in them. Like, ultimately, that is our job, to plant the seed, to help people heal from within, and have each patient be the harbinger of how I can translate or carry that to the next patient. That is also powerful. I would say that the person who inspired me the most is my adoptive grandmother, Ethel Watanabe. She had the courage to take a chance on me, to be a real lifeline, to give me guidance, to give me love, to give me hope, to give me support. That is the same thing that I want to give to my patients, to be that lifeline, to be that support. I get to bear witness day in, day out to people's challenges and also their resilience, their hope, how they are trying to move things forward in their lives. And that is galvanizing.